Real concerns, isn't there? I mean, 760 odd cases in the aged care homes. You'd have to think a number of deaths out of that, and some real tensions between the Victorian government and the federal government today. Get to that. So Scott Morrison cutting short this Queensland tour, three-day tour it was supposed to be, to return to Canberra to deal with the Victorian COVID crisis, particularly the issues around the federal responsibility of aged care. We can reveal more issues around the slow rate of testing in Victoria. My understanding is the Army has done an appraisal on the ground and found that there is double manual loading into computer systems of some cases in regional Victoria, and that the Department of Health system is not hooked up to the systems of the pathology labs, and these are all causing delays. Now, we've seen this bit of a stoush emerge today with Daniel Andrews, the Victorian Premier, trying to turn the focus back onto the federal government's management of aged care, and the feds are not happy with this. More on that in a minute. I'm going to show you more evidence first that it is taking 9 to 10 days for testing results to come back to people. But first, here's a finding from the British science journal Lancet from Dutch scientists from this month in relation to testing and tracing. They found that minimising testing delay had the largest impact on reducing onward transmissions. Optimising testing and tracing coverage and minimising tracing delays, in particular with apps, further enhanced contact tracing effectiveness with the potential to prevent up to 80% of all transmissions. If you got the tests done, if you got the results in early, and then you trace the contacts. The Victorian government, there's no doubt that they've dropped the ball here, Kieran. Here is another letter. We've been showing some of these constituents' letters to the member for Polwarth, Richard Reardon, whose electorate takes in the Colac area in regional Victoria. It's from a young man who has had to isolate in Colac for 10 days to wait for his test result. He talks about a large number of locals waiting a long time for their results. He says, "Today is my 10th day of waiting, and I'm writing to you to explain the hoops I've had to go through with the health department. I'm from Geelong and was only in Colac on the 18th of July to see my girlfriend when the outbreak at the abattoir occurred. My partner's sister attends Trinity, where there was a case, so her sister and her family were screened as a precaution. I had to fight to be tested as I work in the security industry. I do work in aged care, people's homes, etc. So he wanted to be sure that he wasn't bringing anything back to Geelong, as he couldn't live with himself if he brought this back and infected anyone, as well as the fact that his mum and stepdad are prison guards and his stepdad is at high risk from medical conditions. He said, I've spent the past 10 days in Colac in isolation missing work, and that he's willing to, he's still being paid by his great employer, but that isn't the point, as I'm getting concerned about my job security. It is affecting my sleep at night, mental health. He's only 20 years old and yet to establish himself in the industry." Now, here's another letter from the owner of a physiotherapy business in Colac with 26 staff, one of whom had treated a COVID-positive worker from the abattoir. She writes in diary form about how on Sunday, 18th of July, we made a decision that all staff who had treated the abattoir workers should not work on Monday, and I decided to go and get tested with my son. I also had a mild sore throat and a headache. Thought it was the right thing to do to be tested. 10 days later, she writes, Tuesday, 28th of July, as I write this, it is now 10 a.m. I still have not received my results into day 9 now since being tested. I've been let down by an inadequate testing regime, which seems to have no system to ensure timely reporting. Here is the PM from this morning in Queensland before he flew back to Canberra, talking about the fact that he sees the New South Wales system as being the right one, saying they're doing well in contact tracing, in getting hold of those contacts with the clusters, keeping it to 15 to 20 a day, something of a contrast with the Victorian example, and he discusses cutting short his trip because of the Victorian crisis.
There are some concerning outbreaks in New South Wales, but they're getting on top of them extremely quickly and containing them. And they're able to keep their economy open, and they're able to get on top of an outbreak. And it is in Australia's national interest that they be successful. It's as important as that they can demonstrate that success as we right the situation in Victoria, which, in concluding, I just stress again to all of those affected, particularly the families of those in aged care facilities, I want to assure you that this has my number one focus. That's why I'm returning to Canberra.
The Prime Minister and Daniel Andrews talking about conversations they had yesterday and last night about aged care. The PM saying ADF nurses have gone into aged care to assist. I understand 3 nurses went in last night. Victorian Premier, for his part, saying he's not in charge of aged care. He says we're all in this together. He wanted to make the point several times the federal government have asked him for help in regards to aged care, attempting to put the focus back on the feds.
I cannot stand here and tell you that I have confidence that staff and management across a number of private sector aged care facilities are able to provide the care that is appropriate to keep their residents safe. If I could say that, I would. But I won't stand here and say that, and I won't stand here also and say, oh, well, this is just a Commonwealth Government matter. We're all in this together, and that includes governments. That includes premiers and prime ministers.
So Daniel Andrews also said he wouldn't have his mother, who's in her 70s, in some of these facilities, such that they are. Health Minister Greg Hunt seemed a bit offended by that, said his parents had been in aged care. At a press conference an hour later, so an hour after Daniel Andrews, Greg Hunt stands up in Melbourne and he is hammered a little bit in terms of the aged care response of the federal government. And he says, don't forget how all of this started.
Let us go back to the source of this. A massive breach of hotel quarantine. Over nearly 7,000 Victorians have been infected just this month. That goes to all parts of that society, but it's absolutely critical not to pretend that anybody, any system is immune once you have a major community outbreak.
Would you be comfortable with a family or friend, a loved one, living in one of these aged care homes in Victoria?
My father lived in one. Yes, and it's a difficult decision for any family, and it's a difficult time. My father lived in one, and we knew that that meant he was in the latest stages of his life. I cannot imagine better care that my family and my father could have got. And I speak, I think, for hundreds of thousands of families around the country. So yes, and the idea that our carers, that our nurses are not providing that care, I think is a dangerous statement to make. They are wonderful human beings, and I won't hear a word against them.
The Premier today said he wouldn't...
I will not hear a word against them.
So you can feel the political tension in the air in Melbourne, Kieran. So Greg Hunt's point, you have outbreaks across the community all over the world. They're going to spread to aged care. Now, the Premier, he was also asked about this average testing time, or this long period for people to be tested and get their results back. He insisted the average time back is for 2 days, but admitted that's an average.
We are prioritising a number of different tests. We try and be as fair and as clinical and as evidence-based as we can be in that. But my latest advice was that the turnaround was still in the order of around 2 days. That is an average, though. There will be some that are quicker and there'll be some that are longer.